I felt channeling my mother's approval here. Thank you very much for having me. Last time I was here, I was talking about sausages and meat. I did get in trouble with Tesco's for certain references to horse meat. That won't happen this time. But you could say drama and discovery always generate interest and attention. And indeed, you might go on to say that historians are particularly attracted to drama, especially because dramatic episodes such as epidemics leave a tremendous amount of evidence for us to work with. Now, historians of medicine are no exception here. Medicine over the last 3 centuries appears to offer lots of drama as well as heroic developments, while contemporary accounts of medical advances certainly fascinated contemporaries given their appetite for spectacle and progress. Now, numerous histories of Victorian medicine, the period I feel particularly home in, focuses on the changes associated, say, with the laboratory, on the development of new procedures such as antiseptic surgery or on new drugs. A focus on residential institutions such as hospitals and infirmaries or on operating theatres, along with the use of published material, has, as Daisy has written about, created a particular view of medicine in the past. But where new developments have been cast as excellent markers of progress to what might be seen as a modern form of medicine, how much the findings from the laboratory, the development of new procedures, or the introduction of new drugs resulted in changes to doctors' ability to treat disease is an interesting question to think about. For many patients, their experiences of medicine didn't always match the picture of progress we might associate with medicine in the 18th and 19th centuries. Their experiences were often a lot more mundane, less drama, more routine. So what did everyday medicine look like? So in this talk, I'm not going to focus on the dramatic or the new, but on the everyday features of medicine, primarily in the 19th century. And it is nice that the case notes go on to the 19th century, but I'm also a 19th century historian, to give you a sense of the types of medicine people might receive in the home, or say they might receive from a dispensary. So if what constitutes the everyday has remained extremely loosely defined in scholarship, it covers really those aspects of life often dismissed because they're taken for granted. Since roughly 2010, the everyday has become an influential category for writing, one regularly invoked by social historians to get at what's been called the background noise of history. The everyday offers a way to draw attention to the mundane, the unnoticed, the local, the contingent, and the previously unobserved, to get at what might be seen as the lived realities of the past. But the everyday is not just a description of mundane experiences. It provides us with opportunities to think about the complexity of lived experiences and the day-to-day workings of bureaucratic, economic, social systems, to consider what one person, André Blavat, has called the arts of doing. And we might think here that places like the dispensary, the infirmary, the hospital embody in what they're doing the arts of doing, that day-to-day business of treating. So, for instance, we know that during the 19th century, European medical writers defined women through a narrative of reproduction. But records from Victorian hospitals revealed how women reappropriated these ideas to their own ends to gain access to the types of treatment they felt was appropriate. But more than this, the everyday reveals the importance of often overlooked routines and the taken for granted. Now, social historians of medicine are part of this trend to think about the everyday, not just in terms of Roy Porter's call in the 1980s for a medical history from below, but through their use of archival sources to get at a different view of medicine in the past and the patient's experiences of treatment. So the type of insights you get from looking at the dispensary's fantastic casebooks and the related material around it. So what might this everyday medicine actually look like? Oops. It's because I've got two screens. I must remember which one to look at. So we know from the excellent work on quackery and patent medicine and from studies of what social historians of medicine call the medical marketplace that people in the 18th and 19th centuries shopped around for treatment, with evidence suggesting that people were likely to be sick on average 2 to 3 weeks every year. The individuals affected or their family members would assess how serious a condition was, followed by the likely cost of help in terms of money, time and convenience, and then make decisions accordingly. These decisions were influenced by varying socioeconomic circumstances, religious affiliations, levels of literacy, class, community perceptions, and perhaps 1,001 other social, cultural, not to mention individual and personal circumstances. Now, many turn to commercially available remedies before consulting one of the many medical practitioners selling advice or treatment, with the treatments available from learned doctors promising limited therapeutic success until the late 19th century, self-medication, so the sort of domestic medicine, not just rubbing butter into your eye, but a wide range of other treatments, both rooted in folklore, tradition, and over-the-counter remedies, remained a vital source of treatment for all classes. Prudent households into the Edwardian period were well stocked with a supply of laxatives, purgatives, painkillers, cordials, and other everyday medicines. Over-the-counter indigestion remedies and cough mixtures provided symptomatic relief, for example. Some of these medicines were household names. So Dr. James's powders was one of the best-known cures for fever, while Beecham's pills was marketed from 1842 under the slogan, "worth a guinea a box," and was a highly lucrative laxative, and then provides the basis for the company that was to become SmithKline Beecham in the 20th century. Sales of over-the-counter medicines increased tenfold during the 19th century, and outlets expanded with a wide range of medicines readily available from grocers and chemists, and in Scotland from many general practitioners who sold retail medicines over the counter as part of their daily practice. Now, if self-medication was an everyday part of treating a wide range of conditions, what was offered by medical practitioners? And what sources might we use to understand everyday medical practice? Now, we could turn to the surviving records of general practitioners, or look at hospital and infirmary case notes or prescription books, or we could use fantastic resources such as being collected for the People's Dispensary. But the everyday also encourages us to use other sources to get at what might be seen as routine and common. Now, while historians are, quietly coughing, skeptical about using fiction as a historical source, literary texts might offer us cultural artifacts that reveal things about people's lives, often not included in other sources. Often the scholarly focus on fiction is again on the dramatic or the sensational. For instance, most scholarship on Victorian science and literature focuses on exciting sensation fiction, or on Gothic fiction, or on ideas of degeneration, a concept of individual and evolutionary decay which came to inform eugenics at the end of the 19th century and into the 20th century. And they use these fictions to highlight moral concerns at the time, such as about drug addiction or fears of national decline, particularly in an imperial context. But we can read such literary fiction in a different way to examine what might be seen as the routine encounters in medicine. So here I want to draw on short stories by Arthur Conan Doyle, better known for his Sherlock Holmes stories, and L.T. Mead, the pen name of Elizabeth Thomasina Tamerlane Smith, a popular and extremely prolific female author who knew exactly how to gauge the literary marketplace and make a lot of money. Now, Doyle's 15 stories in his book, Round the Red Lamp, and Mead's serialised stories from the diary of a doctor are full of socio-medical concerns familiar to readers at the time, combining the sensational, you've got to have an exciting plot, with the ordinary. They feature educated doctors in detective roles and covered such medical topics as the benefits of bacteriology, to the dangers of hypnotism and addiction, as well as the therapeutic breakthroughs such as antitoxin and antivenin, both of which were popularly lauded as medical advances at the time. So in Mead's short story, The Hooded Death, where a patient is saved through an antivenin, and the same case of Captain Gascoigne, which includes the use of an antitoxin, her works make explicit reference to such therapeutic breakthroughs, noting how the future of therapeutics was, quote, in the marvellous successes which are already attended to the treatment of disease. And many doctors were writing in the same way. They did like to big up medical advances. So why might Doyle and Mead's work be useful to us? So as Doyle reminds us in his short story, The Curse of Eve, while we and the patient in his story might experience events which seem so appallingly important, we also need to be sensitive to how medical fictions, as Doyle writes, reveal the merest everyday matter of the business to the medical man. Both Mead and Doyle fictions are immersed in this everyday business of medicine. If they engage with social medical issues of the day, Conan Doyle and Mead importantly describe interactions between patients and doctors that are not based in an institution. They feature the type of medical encounters we might see with patients who, say, turned up at a dispensary, with these encounters that Doyle and Mead describe occurring in spaces such as the doctor's surgery, which are not entirely similar from the design, layout, and experiences of the People's Dispensary and its physical structures. Even with the inclusion of sensational plot lines, Conan Doyle and Mead focus on the type of medical conditions dispensaries mainly treated. And finally, both authors highlight the type of prescribing that many hundreds of general practitioners around Scotland were engaged in to make ends meet. And this provided a vital service, particularly for poor patients, much like the People's Dispensary. So what did the stories by Conan Doyle and Mead, what they show is how in the second half of the 19th century, how it might have seen the introductions of new treatments, such as new pain-killing and fever-reducing drugs, older remedies based on plant extracts, mineral salts, and inorganic chemicals, not only survived from the 17th and 18th century, but continued to be very actively used. Their stories point to how medicine was often about managing symptoms or ensuring their patients' bodily comfort. We can see the everyday nature of prescribing in both Mead and Conan Doyle's work, not least in how their doctors have medicines to hand as they always travel with, quote, their bag of drugs and instruments. What comes across through these stories is the prosaic management of health, of age, and of bodily comfort. The medicine featured in Round the Red Lamp and Stories from a Diary of a Doctor is the medicine of the routine that consisted of generic drafts, restoratives, sedatives, or narcotics, reflecting a range of common preparations available. Here, a stimulant, a cooling dose, a simple dose, restoratives or soothing remedies form the mainstay of the treatment being described. For example, in Doyle's story of hereditary syphilis, while he considers the moral taint of disease, the treatment prescribed is normalized into a mixture, presumably containing mercury, a common treatment for syphilis, a powder to be taken every morning, possibly a painkiller, and an ointment to be applied to the affected leg. In The Doctor of Holy Land, Mead recounts how the farmer Eaton's leg ulcer was first treated with zinc ointment before being painted with blistering fluid which, after 3 blasphemous nights, was found to stimulate the ulcer into healing. Now, the treatments described are either commonplace, zinc ointment, or so everyday as to remain unnamed, such as the blistering fluid. Readers would know these types of treatment because they were so common and familiar to them. Now, administering such everyday medicines in Conan Doyle's and Mead's stories was a very matter-of-fact business. Their mundanity is part of the realist narrative of medical practice that they capture. Now, one could say, but these are just stories. But at the time, the medical journal, The Lancet, recognized the power of such works to bring medical topics to a wider audience. As noted, Doyle was clear that his stories revealed the merest everyday matter of business to the medical man. As Doyle went on to explain to his readers, he was drawing on his training in Edinburgh and his experiences of general practice. For Doyle, I'm not romanticizing. This is absolute fact in the medical details he include. Now, Mead was inspired to write about medicine by the controversy surrounding tuberculin as a cure for TB. Her stories, as Mead told her readers, are written in collaboration with a medical man of large experience. Many are founded on fact, and all are within the region of practical medical science. She consulted with the Metropolitan Police Surgeon, Edgar Beaumont, and the influence of current medical debates runs right the way through her fiction, from the benefits of bacteriology to the dangers of the hypodermic syringe encouraging addiction. Yet it's not these details which stand out. What their stories illuminate is the important role played by the mundane, modest therapies, which their readers would have encountered on a routine basis when they went to see a doctor. Now, underneath the hype or the controversies, some discoveries or treatments generated was an enduring sense, as one doctor looking back in 1940 on his career noted, treatment was empirical. This reminds us to think less about the drama and more about the routine and mundane treatments patients encountered at a time when good bedside manner and diagnosis remained essential for the work of many doctors in the 18th and 19th centuries. So, for example, rather than thinking about how the celebrated English surgeon Robert Liston could amputate a leg in under 3 minutes, the everyday shows how Victorian surgeons were often very conservative in their approach, even if the introduction of chloroform made more complicated and lengthy operations possible. Most surgery well into the 1890s was about running repairs to the body. Even by the end of the 19th century, hospital care frequently meant bed rest and nursing rather than therapeutic interventions. Workhouse sick wards were little different, though patients were more likely to receive perfunctory care from an unqualified assistant. Now, if Conan Doyle and Mead point to the day-to-day business of treating patients, records from general practitioners equally show how most were involved in routine work, how practical utility and well-trained custom remained the mainstays of treatment throughout the 18th and 19th century. Well-tried customs included still using leeches in the Edwardian periods, alongside such drugs as morphine and aspirin for the relief of pain. Many doctors equally prescribed common medicines, which was less time-consuming than new or novel procedures. They did exactly what Conan Doyle and Mead's fictional doctors did. They worked to relieve symptoms, aid bodily comfort, and support remission or recovery. Even with the development of new treatments or instruments in the 1880s and 1890s, evidence suggests that it was often easier for busy GPs to resort to less time-consuming and traditional methods that found favour with their patients. And most patients' expectations were generally attuned to low-tech encounters. Routine, modest preparations did, however, serve a very important function. They offered relief, while at the same time signifying to the patient that the doctor was actively doing something for them. And as we know, often that sense that someone is working on your behalf, supporting you, giving treatment, can be incredibly important, not only to the patient, but also to families as well. So Doyle and Mead's fictions and their attention to the everyday and the routine remind us how, for many, established remedies and practices persisted and formed the mainstays of treatment in the 18th, 19th, and into the 20th century. While this isn't to suggest that we shouldn't be interested in new treatments or how science was being harnessed to the art of medicine in the 18th and 19th centuries, they show how, for many, medicine was a matter of fact, not a dramatic business. What we get from thinking about the everyday is a sense of a past that is full of the ordinary, the common, the routine, a type of past which gives a sense of some of the lived realities of medical counters, those type of medical counters that patients will be experiencing in the People's Dispensary. So when you think about the records of the People's Dispensary or other medical institutions, you might want to ditch the drama and instead focus on the routine and those medicines which might otherwise be seen as taken for granted, but those medicines that provided important relief and also the hope of cure for many visiting the dispensary. So thank you.